اليوم رح نحكي عن مرضين رئيسيين. أول واحد هو الريفت فالي فيبر. ريفت فالي فيبر من الاسم هو مرض initially even these days يعني still basically reported and endemic in some countries in Africa. لأنه منطقة الريفت هي أحد المناطق اللي موجودة في كينيا. Alright. So far, sporadic outbreaks are reported in Central and Eastern Africa in particular. Okay. And the only escape from Africa to the Middle East was in early 2000 and 2002, basically. And it was in Yemen and Saudi Arabia. Since then, few sporadic outbreaks were reported in those countries, in Yemen and Saudi Arabia. And for Yemen, the whole Yemen is considered at risk and reports several outbreaks from time to time. In Saudi Arabia, it's only the southern part, which is actually bordering Yemen. يعني له حدود مع يمن. Okay? منطقة جيزان بالتحديد. The disease, we'll talk a little bit about history in just 1 minute. The disease is caused by a virus. It is an basically outboard-borne disease. So it is transmitted by insects. And those viruses that are basically carried by insects, we refer to them as arboviruses. Arboviruses. So it's a Filippovirus from the family Baniviridae. This virus is fairly stable virus. It withstands very low temperatures. يعني بتحمل درجات حرارة منخفضة جدا up to -60 even to -80. معظم الفيروسات does, by the way. حتى احنا when we reserve viruses, we reserve them in -80 or at liquid nitrogen. Okay. It can survive the room temperature as well. So up to 23 degrees centigrade, this virus still basically alive. It likes humidity very much. So humidity of 50 to 85%. This is a humidity that is preferred by the virus. And that's why when we study the epidemiology and seasonality and time lapse when, like, you know, those outbreaks happens, we see that those outbreaks, huge outbreaks, so Rift Valley fever were reported after a rainy season, heavy rain, and then after sudden increase in temperature, which is actually, this is the kind of things that creates the suitable environment for the vector to basically thrive and increase in number. So this is an acute febrile disease. It affects sheep, cattle, and goats. It affects camels as well. It causes high abortion rate and deaths in young animals, even in adult animals. It is a very important disease when it comes to humans. This disease can cause death in humans. This is an infectious disease, a zoonotic disease, like, you know, course. So the zoonotic aspect of this disease you need to study about and review, basically. As I said, it comes after heavy rainfalls. It's an outboard-borne disease. And the insect are the mosquitoes. But other insects that can basically transmit and bite, they have epidemiologic importance. نعم. سامعك، علي صوتك. علي صوتك، مش سامع. حدا سمعه؟ acute febrile disease. acute febrile disease هو نفسه الاكيوت، واحد من الاسماء، هو بيعمل acute febrile disease، ليس هو نفسه، يعني الديسكربشن تاعه بيعمل acute febrile، بيعمل high temperature disease، يعني this is a description of the virus. ما بتقدر تيجي تحكي diagnosis acute febrile disease. طب ما هو الاف ام دي جزء منه acute febrile disease، ماشي؟ acute هو description the status of the animal that is affected، ماشي؟ Okay. So some history, first recognized in disease in sheep, basically it was in the 19s, basically early years of the 19s. In 1930, the agent was isolated and basically identified. Since then, the only location, geographical location that were affected, Kenya, and basically an area called the Rift Valley area, which is يعني زي ما نقول احنا منطقة غورية، ماشي؟ انحدارية غورية. So different episodics happened, يعني outbreaks happened. واحدة of the biggest was in 1950 that caused about 500,000 abortions in sheep and 100 million or 100,000 deaths and many human cases. From 1977 to 1978 in Egypt, this is the first outbreak that happened outside the Rift area, the Rift Valley area. It caused 18,000 human cases with about 600 deaths in human in that year. And most human cases suffered encephalitis, hemorrhagic fever, and case fatality was reported 1%. So it's 1%. So 600 dead died. The disease basically was much higher than this, basically. Yani the diseased humans were much higher than the 18,000 reported, but the 18,000, those are that were hospitalized with clinical disease. Because most of the people that were affected, they showed only flu-like syndrome. And none of us go to the hospital if they get flu, right? يعني ما في بينا احنا ناس بيروحوا على المستشفى اذا صار عندهم فلو. فالكميه الكبيره هي فقط بصير عندها فلو لايك، ترش بقول لك انا رشحت خلاص تعبت، نفس شوي تعب، فات الحمام مرتين ثلاث، كذا. هذا the majority of the people that have very good immunity. Those 18,000, those are the ones that went to the hospitals or the clinics, and they experienced some of the clinical signs. Out of those, 600 died. Okay. Those that died usually showed before death encephalitis and hemorrhagic fever. In ruminants in Egypt, numbers of animals that aborted and died were uncountable at that year. They did not pay attention to that when they have that huge human problems. صار عندنا other outbreaks بالسنغال, ماشي, and again in Kenya, but this is the one that was very, let's say, demarcated and people start talking about, which was the first outbreak outside Africa. أول outbreak كانت outside Africa. Frankly, so far here, the only outbreak outside Africa. يمكن واحد يقول لي يا دكتور طب يعني كل هالسنوات مره واحده صارت اوتسايد افريكا، ليش احنا بنحكي عنها هون باسيا؟ Because we used to import animals from Africa, from East Africa in particular. Then we returned back to importing. Last year or the year before, we imported huge numbers of livestock. Then we stopped. But does this mean that we are protected? No, but because actually the whole Gulf area, they import huge numbers from countries that known to be at certain levels of endemicity with Rift Valley fever. مثل السودان استوردوا كميات هائله من السودان، السعوديه مثلا خاصه خلال موسم الحج، والسودان almost on yearly basis they report sporadic outbreaks of Rift Valley fever. Okay? طيب شو صار بالسعوديه يا اخوان؟ The most recent outbreak that there were outbreaks afterwards, like in those that showed human cases, huge human cases. It was in Egypt in 2003 that caused 17 deaths. So let's go back to the epidemiology now. So it is related to heavy rainfalls زي ما حكينا، يعني شتاء كثير في وقت هو فيه basically يعني شتاء موسمية. The temperatures are high and heavy rainfalls happen for 2-3 days. بعدين صارت حرارة عالية. This created the best environment for the vector to proliferate and start hatching the eggs and start producing huge numbers of larvae as well as adult mosquitoes. Adola, they start spreading and they start basically, especially if one animal is infected, this is enough to start spreading to the other animals that are not infected, okay? So, and we see it in a cycling mood, you know? So those scientists that studied this disease, they said, okay, over the years, they found that there is some kind of this epidemiological cycle that happened. Yani if the disease happened in this geographical area, usually it happens in a cycle after 5, and the cycle is from 5 to 20 years. So it may spread to 20 years. So if we look at the cycle in Saudi Arabia, it means that we are very close to see another outbreak. But however, we still see outbreaks in Yemen, but not in Saudi Arabia, because Saudi Arabia practice high biosecurity as well as heavy vaccination. But they are that southern area, they can't say that it's free, because still, when they do serology, they get positive serology. It means that virus is still circulating in that area, okay? Right. So as we see, the disease is mainly in Africa, Central Africa, as well as Eastern Africa. This is the area where the diseases work its magic. And the only outbreak that happened outside Africa were reported in Yemen and Egypt. In Saudi Arabia, since this is the most or the only outbreak that were reported outside Africa and Asia, and you know that we have the longest borders with Saudi Arabia. احنا الأردن أكبر حدود عندنا مع السعودية. كثير ناس بيحكوا مع فلسطين، لا احنا أكبر حدودنا مع السعودية. أوكي؟ لازم نعرف شو صار بالسعودية على أساس إنه نكون احنا حذرين. بالسعودية بالأوت بريك شو صار؟ صار في عندنا بالهيومنز reported cases 683 cases were hospitalized. شو حكينا احنا؟ majority مالهم majority شو كان عندهم؟ flu like syndrome. يعني الماجوريتي they did not go to the hospitals. الماجوريتي ما they did not seek any medical help. خلاص مرض، حس انه اوكي في عندي مشكله، اخذ شويه مسكنات ومشي حاله. About 95 deaths, and I quote here, they wrote in the article that they published 13.9% mortality. This is wrong, because mortality is usually expressed على ايش؟ على population. But this is actually not mortality, this is case fatality. Actually hospitalized case fatality. من الناس اللي فاتت الهوسبيتال من 683 13 اللي هم 95 of those died. ماشي؟ يعني 1/7 of the people that entered the hospital died. Okay? Out of those that are affected, 82.7 were males. السعودية يعني this is normal. لأنه حتى يعني النساء يعني they need to be really sick to go to the hospital because of the culture. This is number one. Number two, women, they don't work with animals. Those that work with animals, those are outside driving and getting from one area to another, from market to market, and go to the livestock market and so on, are the men. Median age were 50 years old. Youngest patient was 14 years old, and in the article they are writing that actually he belongs to a family that practiced livestock raising. 76% had close contact with animals, so, and all these actually agrees with the general concept that we have about this disease. Mosquitoes, Aedes species are the most important species of mosquitoes that is incriminated or are incriminated of transmitting this Filippovirus. Does this mean, for example, Culixes, they don't? No, Culixes does as well. But they found epidemiologists that Aedes is more important or more prevalent. This is one of the transvariant transmission that is happening. It means that the mosquito, the adult mosquito, take the virus and they can pass it to the eggs, to their eggs. So they pass it to the eggs. It means that if one mosquito lay 1,000 eggs, it means that the one mosquito can produce 1,000 transmitter of the disease. So look at the type of amplification that is happening. This is number one. Number two, it means that this mosquito can basically keep it for next season and the season after if they basically go into what the latency. Because sometimes eggs are preserved or adult mosquitoes are preserved to the next season, especially in areas where it's cold, really. Right. So secondary vectors are there. Culixes, anaphylaxis, those are two other mosquito species. Other biting midges, as I said, are very important in transmitting this disease as well. The livestock are considered amplifying host because this is the host where the mosquito take the virus and start spreading. So mosquitoes, they will not transmit the disease from one human to another, but from one animal to another, from one cattle to another or sheep to another. All right? Yes. This is associated with the virus transmission cycle. Humans in some diseases are end hosts. When I say end host, it means that the disease reaches this human and stop. In clear diseases like this, rabies, West Nile virus, humans are end hosts. Okay? So it has to be with the virus and the biology of the virus, plus the action of the vector. Okay? So it seems to be that the body of the human, they don't produce a full particle of virus that is capable of replicating after it enters this type of cells, like human cells. So we already talked about this, and I want you just to know that all these species of mosquitoes that are capable of transmitting the disease, that are capable of transmitting Filippovirus, they are present in Jordan كلهم. يعني في دراسات وجدت الايديس الانافيليس الكوليكسيس كلها موجوده هنا. فاحنا at risk. طيب. What are other methods of transmission بالنسبه للهيومن بالنسبه للانيمالز؟ Direct contact. If you are exposed to the tissue or fluids from infected animals, you may be at risk of having or getting this disease. Especially if you are dealing with aborted materials. We are vets, we always deal with aborted materials, right? Or if you work in slaughterhouses, or if you do necropsy in a hospital or at your clinic. فهذا بحطنا احنا الفيتس من الهايست risk when outbreaks happen of ribavirin. طيب زي ما حكينا ما في عندنا person to person transmission. This disease had very short incubation period, about 3 days average. If this disease hits naive hairs, شو يعني لما اقول انا naive hairs؟ حكيناها المره اللي فاتت، شو يعني؟ ايه؟ Yes، ما تعرض للفيروس whether it's vaccine or infection، ما تعرض للفيروس. So when it hits naive hairs, the abortion rate may reach 100%. يعني morbidity rate may reach 100% in naive hairs. And the abortion here at any stage of abortion of pregnancy. يعني احنا مش بنعرف انه البروسيلا affects في الثيرد trimester كذا الكلاميديا واحنا and this is very important information that we use in order to reach diagnosis in the field. بالريت فالي فيفر any like ممكن تكون early pregnancy, mid pregnancy or at the end stage of pregnancy. Most of the animals they are asymptomatic. ما في symptoms. Most of the animals that are affected asymptomatic. They just abort without showing any symptoms, other symptoms. Good number of them will show symptoms. What type of symptoms? Foul diarrhea, icterus, purulent nasal discharges, and good number of them they show these clinical signs, or without showing any clinical signs, they die. So acute death, when you are presented with certain clinical signs and death, and this is why we call it acute febrile disease, or sometimes as a peracute, quickly after 3 days, have a day, especially if you are dealing with huge livestock, huge numbers, you didn't see any clinical symptoms. You just like the only complaint that you will get from the owners, from livestock owners, from pastorals, انه في عنا death. Okay? شو نفس ما حكيت هلا في منهم you just when you are called as a vet اذا كان في مثلا 1000 head hairs السايز تاع 1000 head الاونر usually they don't see these signs foul diarrhea or icterus mucopollen discharge is only in few but he will just report the death. He will tell you I just came this morning and since actually the incubation period is very short and I found animals dying everywhere. So the only complaint that will come to you death. Like if you are close to these animals, you will see death. Like the majority of animals, they don't show any clinical signs. They just show abortion. They don't die. ماشي؟ بالlamps والkits, even the incubation period is shorter, hours, 12 to 36 hours. يعني owner, they will not be able to tell you what's happening. Very short. في newborns, you just found death without any clinical signs. He will tell you that, you know, yesterday كان عندي 200-300 خروف صغير مولود جديد طلي يعني اليوم ولا واحد كلهم ميتات فتت فقط مذابح على الارض نايمين ماشي. If he gets to see clinical signs, what type of clinical signs? أهم شيء febrile, high fever, ماشي. Animals become anorexic, they stop eating, they stop suckling, هذول بالnewborns, ماشي. بعدين they die, and this is especially in animals that are less than 1 week old. Animals that are a little bit older may basically show more resistance. However, the mortality is still 20%. The mortality in animals that are less than 1 week may reach 90%, even 100%. Mortality after 2 weeks of age, yani after they pass 2 weeks of age, may just like be 20%. And still, this 20% is very high mortality. In adults, what kind of clinical signs we see? Most of the animals are asymptomatic. Sometimes you don't see any clinical signs other than abortion. Like it, if you see signs, fever, weakness, anorexia, ماشي, reluctance to move, diarrhea, icterus, and mortality usually lower than young animals, 10%. But abortion could be 100%. So just animals abort without any clinical signs. Cows usually act similar actions or similar actions to the labs, and mortality may reach to 70%. Post-mortem lesions. This is a kind of a disease that the virus itself prefer mostly the liver. So we see a lot of changes, pathological changes in the liver. So the liver is enlarged, we call it hepatic necrosis, enlarged, yellow, and friable. And we see petechiations that are very prominent because cutaneous and serosal layers that liver. Does it affect other species? In dogs, Filippovirus cause abortion, all right, may even kill the puppies. In cats, they may kill the kittens, all right? In horses, they become viremic, but they are resistant. And this is very important epidemiologic information. So horses may actually become, since they are viremic, it means that if a mosquito bites or suckle or gets some blood from horses, they can transmit it to other animals. So Horses could be a very important epidemiological unit. Pigs are resistant, and birds are refractory. So they get the virus, and then they fly until they reach another area. They settle there, and the mosquitoes start working there. So they play a role in transmitting the disease over long distances. So we call them refractories. How we control this disease? Now, first of all, you need to be quick in diagnosis, because once you get it, you need to practice certain actions. The first one is biosecurity actions, which is segregation of the farm, cleaning, disinfection. The second action, vector control. You have to start eliminating these insects and the environments that are necessary for the insects to thrive and hatch and multiply. Secondly, we will practice vaccination. And usually it's not advisable to vaccinate the whole country. So we don't practice mass vaccination, because we don't want, once you practice mass vaccination, you can't claim that you are free anymore. So usually we practice zonal vaccination, but the type of vaccine that you use has or reflects on the quality of the program that you are using. All right. For human beings, when this disease happens, try to practice safety by not getting bites from insects, wear basically sleeves and longer pants, try to cover areas where the mosquitoes can basically bite you, use mosquito repellents, and basically avoid working with aborted materials, avoid working with dead animals without using your PEPs, personal equipments, protection, PPEs, personal protective equipments. This is very important in case of Rift Valley fever. All right. Vaccination, we have two different vaccines that are in the market. One that is killed vaccine, and the other one is a live attenuated modified vaccine. بنسميها اللايف attenuated vaccine. هو بسموه strain خاصة اسمها سميث بيرن strain. Basically now allow people, they start using this modified live vaccine heavily. Smith Byrne, I think. Just check, guys. Maybe the spelling wrong. All right. And again, we don't recommend the blanket vaccination. Usually, we recommend a zonal vaccination. But the most important one is not the vaccination, rather than monitoring. هاي معلومة مش موجودة بالسلايدات فانتبهوا لها. One way actually to monitor for infection and spread of the virus is to have what we call centennial monitoring herds. It means that we assign certain sheep and goat herds or sheep herds in area where the risk is high, and then we do surveillance for these on a regular basis. And this is what Saudi Arabia did and still doing. They have farmers near the borders with Yemen, and those farmers, the Saudis, the government itself gave certain numbers of animals, 100, 200 sheep free, and feed for these sheep. And they told them, you can use them, you can use their offsprings, milk, whatever, but you are not allowed to vaccinate or sell those animals. They don't vaccinate them because they want them to stay seronegative and to use them as monitors. So on a regular basis, they go to these farms, monitoring herds, we call them. They sample them and then they test their antibody, presence of antibodies to see if the virus starts spreading or not in that area again. We call them centennial monitoring herds. Okay? طبعا it's very expensive. يعني بدك دولة تكون عندها فلوس to do such test. Second disease of the day هو Vesicular Stomatitis. This is a multi-species disease. This is a mucosal disease. All right? We usually mistake it with other mucosal diseases. It's caused by Arabdovirus. The vesicular virus is an RNA virus. We have different types. Usually this disease is more in the Western Hemisphere, so it's not that important in our area, but we import a lot of animals from, especially producing animals from the Western Hemisphere. Okay? It affects horses, cattle, swine, and camels. In addition to that, humans. So this is a very important zoonotic disease. Sheep and goat are resistant. So this is one epidemiological fact that we can use to identify this disease. هاي واحدة من المعلومات الابديميولوجية عشان نشخص هذا المرض إنه بنشوف بالarea where the disease is hitting, sheep and goat are not affected, only cattle. الاوت بريك الاخيره بتاعت الاف ام دي اللي صار عليها اخبار تلفزيون اللي مدتنا بالاردن قبل سنه او اقل من سنه. Initially we thought it might be actually vesicular stomatitis. ليه؟ لانه الشيب والgoat were not affected. But then when we sent to the reference laboratories, it came back as SAT2 FMD. Okay? So it resembles very much FMD. زي ما حكينا mainly هو بالويسترن هيمسفير. ما بدي أنا to go through this. Morbidity بالنaive herds may reach 90%. Okay. However, these days we only experience sporadic outbreaks. I'm not talking about Jordan, about the world. Mortality is very low. But this is a vector-borne disease. FMD is not a vector-borne disease. It's not an arthropod virus. The FMD virus is not an arthropod virus. This virus is an arthropod virus. It is transmitted by the sandflies, by the black flies, and by the other insects as well. So mosquitoes may play a role, other biting midgets, they play a role in the basically transmission. Incubation period is very short, 3 to 5 days. Fever, vesicular, and vesicles start appearing. Those vesicles resemble FMD even in the same areas where FMD exists, in mouth, buccal cavity, oral, drooling, chomping, mouth rubbing, lameness, typical signs of FMD. Even in the area in the legs, we said the coronary usually affected in FMD, and interdigital space, the same areas are affected here as well. Okay? Vesicles may be seen on the oral, but even on the mammary glands, coronary bands, and interdigital regions, as I said. Usually animals recover in their own, similar to FMD, in 2 weeks. So this disease resembles very much FMD again. That's why you need to keep it in mind, especially if you work in an area where vesicular stomatitis was reported before and an outbreak happened, sheep are not involved, and you are trying to isolate the virus and you are not isolating the FMD virus, most likely this is a vesicular stomatitis disease. especially if you have horses in close proximities and horses show clinical signs as well. Because FMD horses, they are resistant, they don't show clinical signs. So this is a type of disease that you kind of like in the field recognize by the hosts that are affected, by elimination, process of elimination. Type. Vesicular stomatitis disease is not as contagious as FMD. So this is another epidemiological fact that you need to remember. When you see only few cases in the herd, but not the whole herd affected, then you start thinking FMD is a very contagious disease. Actually, one of the diseases that has the highest contagiousity. All right? Why only few animals affected? Then you start thinking of maybe the vaccine is working. This is number one. But you start thinking of other viruses, and one of those viruses is the vesicular stomatitis. How we diagnose it? We diagnose it using laboratory methods. We have ELISA, all right? But even we can use other methods like virus isolation on tissue culture, or even by PCR. We have other tests like complement fixation tests and basically other types of tests, but mainly we depend on ELISA, virus neutralization, and PCR. Treatment is a bad disease, no specific treatment. We just use supportive treatment, all right? We try to prevent secondary infection. Sometimes we give electrolytes. Antibiotics for secondary infections, as I said. Usually the disease has very good prognosis, and production animals may suffer some losses, all right? But this is actually more important in horses as a disease than other livestock. Okay? How we prevent it? With vaccine. The vaccine is not very well known from efficacy point of view, but in certain areas it's practiced. But again, even in the northern hemisphere, they don't care much for vaccines. They rather than isolate the farm and keep the virus until it ends itself. In 2 weeks period, the animals will start producing and life will be beautiful. So they only actually practice biosecurity by not bringing any positive animals to the herd, and by not letting any positive animals or clinically sick animals leaving the herd, by minimizing contacts with basically other farms, and by practicing biosecurity in its all forms like cleaning and disinfection. All right? And since it's an orthopod virus, practicing vector control. في أي أسئلة شباب؟ عندكم أي أسئلة؟ سميث بام. سميث بام. هلا مسجلة عندك يعني. هي فيش الا اتنويتد او كلب فاكسين. سميث بان هي اكثر وحده. في وحده ثانيه في سترين ثاني اسمها كلون 13 او كلون 1. read about it. كلون ايش كلون ذا كلون سترين. كمان هاي في منها موديفايد لايف فيكل. اكثر شيء